Je m'appelle Ganeshan, madame Mauritius, on a 46 ans. Je fais des démarches pour me faire transplant, 5 ans, je me fais déjà dire.
My name is Cindy. I come from Mauritius and I'm a wife of Ganeshan. He has been on dialysis for 5 years and searching for a transplant. As in Mauritius, we can't do transplant. Renal transplant. We have searched for some information about, and when we search from, we have been informed that in India we can do ABO, incompatible renal transplant, as my mother-in-law is 8 and my husband is 0. They say that it can be done in India. We have been through multiple hospitals and only Manipal Hospital has accepted the renal transplant.
Hi, I am Dr. Deepak Kumar Chithralli, consultant nephrologist and transplant physician at Manipal Hospitals. This is regarding patient Mr. Ganeshan, whom we did renal transplantation a couple of weeks back. It was a complicated transplant, because he had a lot of underlying issues which were very difficult to solve or difficult to sort out. Just to give a background about this particular patient, he had undergone transplantation once and his kidney has failed over a period of time. Now he was back on hemodialysis, and doing a transplant for him was very difficult because it's the second time which he was supposed to undergo kidney transplantation.
Deepak sir has accepted the ABO compatible renal transplant. Although it is a complicated one, he gave us the insurance and he explained to us the procedures. We have been here since January. He started dialysis and also some procedures before we transplant.
And second thing was, though his mother wants to donate kidney, the blood group was not matching. That is, his mother's group was A and his blood group was O. So to match this blood group and to do kidney transplantation was technically very, very challenging. And also, since it was a second kidney transplant for him, he would have had a lot of antibodies against the first kidney, which would also cross-react with the second kidney. So that complicated it was. But doing transplant was very important for him. He had traveled all the way from Mauritius and he had come here seeking kidney transplantation. Life for him would be difficult on dialysis also. He couldn't continue dialysis for a longer time because he already had a lot of bone deformities and bone abnormalities which can happen when somebody is on long-term dialysis. He also had heart issues. His heart valves were weak, which on continuing on dialysis, which would be very difficult or it would be risky for his life if he continued on dialysis with that damaged valves. Also, he didn't have any access to do dialysis for a longer time. He had AV fistula which was blocked, and also it had developed aneurysm and it was difficult to continue doing dialysis through that AV fistula. So that's why transplantation was imminent for him. But as I mentioned earlier, the challenges were more. So we had to provide, or we had to make sure he is fit before transplantation. We had to make sure we made a tailor-made immunosuppression for him before proceeding with the transplant because of second transplant status. Now the most important thing, as I mentioned earlier, which was an ABO incompatible transplantation, that is transplanting against different blood group. So we were going to put an A blood group kidney into O blood group recipient. So before doing this transplantation, we had to remove all those antibodies against the A blood group, what we call it as anti-A antibodies. We did it a week before transplantation by special procedures called plasmapheresis, and also used immunoadsorption by using a special filter which would remove only those antibodies against the opposite blood group, that is anti-A antibodies. Once the antibody levels came down to minimal, then our team of doctors, our surgical team, anesthesia team and the nephrology team, transplantation is always a complex teamwork. So all of us went ahead and did transplant for him. Post-transplant, he had a little difficult course in terms of recovery because of different blood group transplant and the second transplant. But eventually, because of his positive mindset and with all the team efforts and the facilities what we had at Manipal Hospital, we were able to successfully do the complex kidney transplantation with a different blood group donor. So now he's happy, he's doing well, his creatinine is normalized, he's ready to go back to his country, that is Mauritius. We are also happy that we were able to give him a new lease of life. Telling about this different blood group transplant, our center, that is Manipal Hospital, is one of the center where we have pioneered doing this type of transplant. So far we have done about 35 odd different blood group transplantation, which is done very rarely in India. Very few centers do this complex transplant. And in fact, in Karnataka, we are the center with highest series and with good outcomes of such ABO incompatible transplant. So this message should spread, because most of the times it is known that different blood group means we cannot do kidney transplantation. So message should go out loud that, even with different blood group, kidney transplantation can be done, and it can be very successful as similar to the same blood group transplantation.
On a fait recherche, on a trouvé dans l'un qu'à faire transplant. Là, mon groupe O, mon maman, ce groupe A. Là, nous fait des moches, donc c'est pas qu'il y a nous qu'à faire dans l'un. Là, nous fait une transplant. Là, on refuse. Donc, il y a pas qu'on accepte de faire une transplant. Là, on refuse.
And after that, the transplant has been done and very successful. I would like to thank Deepak sir for his patient. He is a savior. He is very clinically calm. And I would like also to thank all the nephrologist staff, Ms. Gina, and also Ms. Puti for her support, the staff of CTVS, and especially Divesh and Krishna sir for their support. I want to thank them all for their great job. And finally, I would like to thank the Manipal Hospital Vashwanpur staff, the doctors, and everyone for their good job. They have been like a family for us, and I want to thank them all.